Hi, my name is LeAnn Norton. I'm doing my assessment on Ashton Whitmore for 360 Health Assessment. First, I'm going to start off and I'm going to assess the person and her consciousness. I'm going to ask you to state your name and date of birth for me.
Ashton Whitmore, 5/16/1991.
What is today's date?
May 6, 2016.
Okay, where are you at right now?
I'm in my apartment
And why are you here?
for the health assessment.
So after establishing that, I'm also going to be listening to her speech during that. I'm going to check for facial symmetry as well as I'm going to listen for the correct word usage and make sure that there's no slurring. Next, I'm going to be assessing all of the cranial nerves. The first one that I'm going to start off with is the olfactory, or your sense of smell. I'm going to have you occlude one nostril and close your eyes. I'm going to show you a very familiar scent and I'll have you tell me what it is.
Toothpaste.
Okay, can you do the same with the other side?
Toothpaste.
Okay. For the second, I'm going to be checking, I would use an ophthalmoscope, which I don't have because I would be checking the fundus in the optic nerve. So I'm going to skip that since I don't have that on me. Next, I'm going to check for your cardinal fields of gaze. Can I have you watch the tip of my pen light? I'm just going to move it around. And I'm just going to ask that you follow. Okay. I'm also going to have you continue looking at this. I'm going to check. Okay. And then last, I'm going to have to remove your glasses. And I'm going to just check and make sure that your pupils are equal. I'm going to place my hand in the middle of your head. Okay. Pupils are equal and reactive to light and accommodation. Next is the trigeminal muscle. There are two parts to this. The first part is motor. So I'm going to just be checking your temporal and your mandibular. So if you can just open your mouth up, like open and close it multiple times. Okay, I'm just checking to make sure everything's equal there. Okay, next I'm just going to have you close your eyes again. I'm going to do the sensory part. I'm going to touch something onto your face and I want you to tell me now when I do.
No. 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 No.
Okay. That's all intact. Next after that, I'm going to be checking the facial nerve, which when you check speech, you do also check, but it's basically looking for symmetry. Can I have you smile and frown, and then close your eyes very tightly? Okay. After that, I'm going to be checking the acoustic, so I'm going to be performing the whisper test. I'm just going to have you close your eyes and relax. I'm going to whisper something in your ear, and I ask that you repeat it back to me.
1, 2, 3. 1, 2, 3.
Oh, that is intact. Next, I'm going to be checking the vagus. I'm going to look inside your mouth. Your gloves. Look inside your mouth and check at your uvula, your tonsils, and also just check the inner areas of your mouth for any sores or lesions. Can I have you say ah?
Ah.
Okay, tonsils look to be at a +2. Uvula is midline and rises. Can I have you stick out your tongue for me? Okay, and then can you move it to one side of your mouth and to the other? Okay. So with that, I was also able to check the hypoglossal nerve. Can I also have you say the words light,
Light.
tight,
Tight.
and dynamite?
Dynamite.
Okay. I'm going to place my hands on your shoulders, and I'm going to have you lift up your shoulders with the resistance in my hands. Okay, and then I'm also just going to feel and make sure I'm not noting any differences or any issues with any of your muscles. That was testing the spinal accessory nerve. And next I'm going to move on to your deep tendon reflexes. Because I don't have the proper equipment, we're going to just use a heavy knife. I'm going to check the brachial first. So I'm just going to have you relax your arm. Okay. They grade a +2 to, or a 0 to a +4 on this. And anything from a 0 or from a 1 to a 3 is considered normal. 4 requires reassessment. Next, I'm going to place your arm for the Next is your radial. I'm going to hold your thumb. I'm going to just tap lightly here. Okay. I'm going to hold your other thumb. Okay. Next, I want to make sure her feet are dangling, and I'm going to just tap on the knee. Okay. And then the last one is the Achilles. I'm going to lift up your heel, and I'm going to just tap on the bottom of the Achilles. After that, I'm going to have you stand up and we'll do the gait portion. Next, I'm going to assess Ashton's gait. Could I have you walk from here to the edge of that counter? And I'm just going to be assessing and making sure that she's walking straight with no issues, no limp noted. I'm also going to ask that you stand with your hands at your side on both your feet, just naturally, and then close your eyes. What I'm testing for is Romberg. A positive Romberg would mean that she would start to sway to one direction as she's standing. Okay, that's good, thank you. I'm going to turn, and I'm just going to check your spine and your scalp. I'm going to make sure everything's midline and that there's no scoliosis. Okay, I'll have you turn back around. And now I'm just going to check your range of motion. So I'm just going to take your head and just relax. I'm just going to turn it side to side and rotate up and down. And then can I have you try to touch your ear to your shoulder? Okay, and the other side. Okay. Next I'm going to do shoulder. I'm just going to check and make sure that we're able to go in all the directions that we need to. Okay, and the other side. Okay. Next I'm going to have you take your wrists and lift them up, down, and roll in a circle. Then your hips, I'm going to have you lift your hip up and down, out to the side, and down. Same with the other foot. Up, down, to the side, down. And then your ankle, if you can just roll it in front of you. And the other foot. Okay. Everything looks to be good there. No issues noted. So next I'm going to have you take a seat, and I'm going to assess respiratory. So first thing I'm going to want to do is I'm going to want to check the color of her skin and overall the anterior and posterior of her thorax. I'm going to check for any lesions or any discolorations. I also want to check for any signs of uneven breathing or accessory muscle use. Can I just have you take a breath in for me and out? Okay. I don't see any barrel chest signs or any air trapping or any accessory muscle use. I'm going to just take a listen to your lungs. Can I have you take a big deep breath in for me? And out. Deep breath in. And out. Deep breath in. And out. Deep breath in. Out. In. Out. In. Out. I'm going to check both sides. Deep breath in. And out. And deep breath in. And out. I've listened to both the upper, middle, and lower lobes bilaterally. Everything sounds clear. I don't notice any wheezing or crackles or any advantageous lung sounds. Next, I'm going to move on to the heart. I'm going to look at your capillary refill. So I'm just going to take your hands and I'm going to really quick push on your nail beds. And I'm just going to make sure that you're having a capillary refill of 3 seconds or shorter. That just means that your heart's working well. Okay. I've already assessed skin and I've noted that she has no lesions or markers of any disease. I'm going to listen to your chest in 4 different spots. I'm going to start with the aortic, right here. And you can just breathe naturally. I'm just checking heart sounds. Then the pulmonic. I'm going to check the tricuspid, sorry. Okay. And the mitral. Okay. I'm going to look at her jugular vein for any distension, and if I saw any distension, I would note a thrill or a bruit. I see no distension noted on either side for her. I'm also going to check her arteries. I'm going to start with the brachial. Okay, Okay, and the radial. Okay. Okay, I'm going to check carotids. I would do femoral, but for patient privacy, I'm going to skip that. Then next would be popliteal, so I'm going to scoot underneath your jeans to listen, or to feel. Okay. Okay, post-tibialis, there we go, and the dorsalis pedis. If the dorsalis pedis or posterior tibialis are unable to be felt naturally, you can grab a Doppler and use that. I do not have a Doppler on me, but I was able to feel both of hers. Last part of the assessment that I'm going to do is the abdominal. So how it first starts is you'll want to inspect first before you touch or auscultate, due to the fact that you could change the peristaltic movements. I'm going to have to lift up your shirt just to about where your bra line is. Okay. I'm going to note any lesions, any abdominal distension. Seeing none, I'm going to take a listen. I'm going to start in the upper right quadrant. Vowel sounds are active and present in all 4 quadrants. Next, I'm going to do a little bit of auscultation for heart sounds, and then for some artery bruit points. I'm going to go about midline between the sternum and the belly button for the aortic. And then on the left and right, respectively, there is the kidney or renal. A little lower than that is the popliteal, or not, iliac, sorry. And then right about hip level is the femoral. After hearing all of those, for the last part of the bowel assessment, I'm going to start with percussion and then follow that with palpation. So for percussion, I'm just listening for any abnormal sounds. Okay, then I'm going to start with light palpation, follow that by a little bit deeper palpation. Do you want to let me know if any of this is tender to you?
I'm ticklish.
I'm sorry. For deeper palpation, I'm looking for the liver on the patient's right side, and I'm looking for the spleen on the patient's left side. So what I'm going to try to do is I'm going to try to palpate and feel the borders of the liver. Okay, and then I'm going to go over and I'm going to try to feel for the borders of the spleen. Okay. You can put your shirt back down. That ends my assessment for 360 health assessment.